Hello, it's CJ. Welcome to week 11 of your pregnancy. Today we're going to talk about what's happening with your tiny human, some of the more common symptoms that you may be having, what you can do to alleviate those symptoms, and what symptoms are not okay. And if you stick around, I will tell you the 6 things that I recommend you do that can help promote a healthy pregnancy. So this week, inside of your uterus, your little one is now roughly the same size as a baby potato. He or she is measuring about 1.6 inches, that's 4.1 centimeters, from the top of their head to the bottom of their booty, and weighing about 1.6 ounces or 45 grams. The major organs are all present and starting to function, and this week your little one is learning how to swallow as well as breathe. The genitals are starting to form, however, it is still too early to see those on ultrasound just yet. The heart continues to beat 140 to 170 times per minute. This week, your baby has distinct fingers and toes. The yolk sac that was providing the nutrients to the baby is starting to dissolve, and the placenta has now taken over that job, which is very good news because your hormone levels are starting to come down. That being said, here are the 7 most common symptoms that you can expect to be having. Number 1, nausea with or without vomiting. I recommend small, frequent meals throughout the day. Avoid foods that are greasy and or spicy. And if you can't keep anything down, please talk to your provider about medication that can help with those symptoms. Number 2, fatigue. You are so tired. Try to get as much rest as you possibly can and incorporate snacks throughout the day that contain both protein as well as carbohydrates to keep your energy level up. Number 3, constipation with bloating and gas. Make sure you're staying well hydrated and try to incorporate high fiber foods into your diet. Number 4, frequent heartburn. Again, small frequent meals throughout the day. Avoid laying down for 2 to 3 hours after you eat. And also try not to drink a lot of liquids with your meals. Number 5, frequent headaches. That is caused by the high levels of estrogen that your placenta is producing. Again, make sure you're staying well hydrated and try to keep your stress level at a minimum. Number 6, nasal congestion. That is being caused by the high levels of progesterone produced by your placenta. And finally, number 7, you may be starting to see a little bit of a baby bump, especially if this is not your first pregnancy or you are carrying more than one baby. If this is your first pregnancy and you do not have a bump yet, that is okay. You still have excellent abdominal tone. That bump will be here eventually. So what symptoms are not okay? Bright red bleeding that's enough to saturate a pad. Cramping that won't go away. Severe pain of any kind that is persistent. It is also not okay for you to vomit several times a day for several days in a row. That is something your provider definitely needs to know about. So here are the 6 things that I recommend you do that can help promote a healthy pregnancy. Number 1, take a prenatal vitamin every single day. If you still can't get past the smell of them, it is fine for you to take an over-the-counter gummy. Number 2, if you are getting your appetite back, focus on eating foods that are healthy. Fruits and vegetables, whole grain breads and cereals, lean meat. Number 3, do your best to stay hydrated. Ideally, you want to drink somewhere between 64 and 96 ounces. That's about 2 to 3 liters of water every single day. Number 4, limit your caffeine intake to no more than 200 milligrams every single day. 200 milligrams is the equivalent of a 12-ounce cup of coffee. Number 5, unless you have been instructed otherwise, try to stay active. You can exercise, you can have sex, you can go on vacation. As I like to tell all of my patients, you're not sick, you're pregnant, live your life. And number 6, make sure that you are writing down all of the questions that you and your partner have in anticipation of your next OB visit. In the meantime, if there are any questions that I can answer for you, I hope you'll leave those in the comment section below. And while you're down in that comment section, I would also really appreciate it if you'd hit the like button and or share this video. Hello, it's CJ. Thank you so much for watching the entire video. I truly do hope that the information has been helpful. When I make these videos, it is not meant to replace a visit with your healthcare provider. Rather, my hope is after watching my video, you know what questions to ask your provider at your next visit to best meet your own healthcare needs. In the meantime, if there's any questions that I can answer, I hope you'll reach out to me. And finally, if you have not already subscribed to my channel, I'd really appreciate it if you did that. That's all I have for today. This is CJ, and I am at your cervix.